When we talk about a failed root canal treatment, we have to be realistic. It's almost impossible to know exactly why the first root canal treatment failed. And the reason is simple. The treatment was done in the past and we don't have all the details of what happened back then. We don't know exactly what the canal's anatomy looked like. We don't know exactly if there is any hidden canal that wasn't cleaned. Was there any blockage that didn't allow the dentist to reach all the way to the apex? Was rubber dam was used? Did bacteria leak into the canal before the permanent filling or after the permanent filling? Some of this information we can get by asking questions. Some of it we can see on x-rays, and some of it we will simply never know. So what can we do in these cases? Basically, so we can try to put the pieces together and collect as much information as possible. In addition to the clinical examination, we start with the clinical exam in the chair, then we analyze the x-rays, periapical or even better, CBCT, and try to see where the problem began. CBCT is especially important because we can see exactly where the bone loss is. Is it at the apex or is it at the side of the root? Is it buccal or lingual? Is it involved in one root or multiple roots? After that, we evaluate the quality of the previous treatment. Is there a crown? Is there a post? And how much tooth structure is left? And then we arrive at the key question. Is retreatment possible without putting the tooth at significant risk? And here we have to discuss a very important concept in dentistry, risk versus benefits. Before we decide to redo the treatment, we have to weigh everything carefully. What are the benefits if we retreat the tooth? Will it really increase the chances of saving it? Versus what are the risks? Could the tooth fracture? Could we lose more tooth structure? Is this tooth even a good candidate for retreatment in the first place? In some cases, retreatment is the best and safest option. In other cases, it's not. A surgical approach might be better. Or sometimes extraction is actually the right decision. And that's where the dentist role comes in, to look at the whole picture and choose the option that gives you maximum benefit with the minimum harm. Because the truth is, there is no single rule that fits every case, and every tooth has its own story, and every patient has their own situation. And the goal is always the same, to preserve the tooth as much as possible and to offer a well-planned treatment that gives the best possible outcome.